Not really sure I deserve to be here, but it's a great honor to sit and talk with you guys today. Let's see. Yep. So I have done some work for Intuitive in the past, just testing and mentoring. So there's a lot of misconceptions, about robotics. It takes longer than regular surgery. Robotic turnover is always going to take longer. It can only be done during business hours, and my hospital is not going to support me. When I started at my hospital, I hadn't done robotics. We had a 6-year-old SI robot that was doing 15 gynecological cases a quarter. At the end of 2 years, we were doing 450 a year. We were doing it 24 hours a day. And we really changed how we looked at robotics. It wasn't just that big piece of machinery in the corner collecting dust. We turned it into a tool. And there we go. So the one thing we talk about with robotics is your learning curve. I know they always say you should start off with gallbladders, but for whatever reason, I did 25 inguinal hernias for my first. That was what I started with. As you can see just on here, that your learning curve over time gets better. Anything you do, the more you do it, you get better at it. The same thing can be said with your turnover. One of the things that we did was I approached my hospital and I said, why does it take an hour to turn over a robotic case? The only thing that's different, at least from my perspective, is it takes about 5 minutes to drape the robot. That shouldn't add 30 minutes to our turnover or our expectation of a turnover. So I asked them, let's bring in younger people, newer people who aren't jaded about what turnover should take. And we took someone who was a nursing graduate who had just been 6 months in our OR, and we made them our coordinator. We took 2 scrub techs and we made them our lead scrub techs for all robotic cases that were done during block time. And we established block time based on the number of robotic cases you had done in a year to earn that. And we guaranteed people if they came on their block time, they would have team A or team B to do their cases. And immediately you can see our turnover times dropped significantly. Now, there were a couple of things that I did to kind of help facilitate that, and I'll go through in a minute. But this is just one thing that we did. It's routine for me to be able to do 5 or 6 cases in a day. This one particular day, we did 7 cases. First cut was at 7:45 in the morning, and I was at dinner with my wife by 6:30 that night. Real cases, not 5-minute little operations, bilateral inguinals, recurrence, ventral hernias, and inpatient gallbladders, which are my least favorite thing in the world. So what I did was 7 patients, a total of 12 CPT codes, spent 620 minutes in the OR, turnover time around 25 minutes. And then I broke it down to the in-the-room time and the console time. So if you look at that, it's about 210 minutes, so that's 7 cases. That's about 30 minutes to set up and close off the console. So 15 minutes to actually get in the room, get started, get going, dock, undock, and get out of the room. So the thing that I think is most important is a motivated team. I bought a lot of pizza. It sounds silly, but sitting down with your team members and developing a relationship, and maybe everybody else knows this, but I'm young. I've only been out in 4 years. But developing a relationship with the people that you work with every single day and having a positive relationship with them, they want to work for you. If you're grumpy, if you're difficult to work with, nobody wants to work with you and no one's going to go to bat for you. The other thing that I noticed was a good communication with anesthesia. When I started to put my mesh in, I knew I had about 10 minutes before I was going to be closing. And so I tell my anesthesiologist, hey, 10 minutes. They can start working up the patient. The other thing that I do is The second that I start to close, my scrub tech hands me a Mayo stand with everything I need to close, and they walk away and they start breaking down the case. Their involvement is over. It's just me. And by the time that I get done closing, putting on my steri strips, and taking everything else down, they've already broken down the robot, they've broken down their back table, and the only thing they have to do is wheel the patient out and clean the room. We have a storage system in our robotic room that I'll show you here in just a second, but I think that really streamlines things too. There we go. So, in the back of our OR, in OR4, we've got lap trays, all of our instruments in individual peel packs, and then all of our sutures and everything that we use. When we first started off, we had a robotic tray, and there was a dozen instruments in it, and you open that tray and you might use one thing, you might not use the scissors, you might just use a pro grip. But at the end of the day, the gynecologist would come by afterwards and they've already used the 4 trays, or I've used the 4 trays, and now they're trying to turn everything over. They don't have the instruments they need because we used everything in the tray. So we went to individual peel-packed items. It cut down on our turnover of instruments, and it really helped to kind of make the room efficient, because now as my scrub tech is sitting here pulling for the next case, they don't have to go anywhere. They're not walking out of the room, oh, I forgot this, turn around, walk back. Everything's right there, and it just makes for a very efficient day. So, the one thing I would say to you is there is a robotic learning curve. I think there's an efficiency learning curve as well. And I think it is our job to lead that charge. So thank you very much for your time today.
That was great.